everyone, and welcome to our deep dive into the world of hepatitis.
Yeah.
I know you're all busy out there, so whether you are cramming for a big presentation or just genuinely curious,
Right.
we're going to explore hepatitis today
Absolutely.
in a way that's both informative but also interesting.
Yeah, most people think of hepatitis as just one thing, but it's really quite complex.
Yeah,
It's an umbrella term for liver inflammation
right.
with a variety of different causes.
And that's where our deep dive begins.
Absolutely.
We're going to explore the surprising variety of hepatitis, viral, alcoholic, autoimmune, even drug-induced.
Oh, yeah.
But before we go there,
Okay.
I think it's important to understand just why the liver is so important in the first place. Why should we care if it's inflamed?
Yeah, the liver is a remarkable organ. Think of it as your body's own detoxification center.
Okay.
It filters toxins from your blood,
Right.
produces proteins that are essential for clotting and other functions,
Okay.
and even plays a crucial role in digestion.
So it does a lot.
It does a lot.
Wow.
So when the liver is inflamed, it can really affect your entire body.
So let's say someone is listening right now
Okay.
and thinking, okay, this is interesting, but how would I even know if my liver's in trouble?
Right.
What are some signs of hepatitis?
Well, a lot of the symptoms are pretty common, like fatigue and nausea.
Right.
But one that always catches people's attention is jaundice.
Jaundice.
Yeah.
Okay. You have to explain that one.
Imagine waking up one morning and seeing your skin and the whites of your eyes have turned yellow.
Oh, wow.
That's jaundice.
Okay.
It happens when bilirubin,
Yeah.
which is a yellow pigment produced during the normal breakdown of red blood cells, builds up in your blood because the liver isn't processing it properly.
Right.
So it's a pretty clear visual signal that something's wrong.
Wow, that's definitely a symptom you would not miss.
Yeah.
So if someone notices this
Right.
and they go to the doctor, how do they figure out which type of hepatitis it is?
Well, doctors have to become medical detectives in a way.
Okay.
They'll use blood tests to check your liver enzyme levels,
Right.
which will be elevated if there's inflammation.
Okay.
They might also do serological tests.
Now, I've heard that term before, but I'm not entirely sure what that means.
Sure.
Can you break it down for us?
Absolutely. You
Okay.
can imagine our immune system as kind of like an army defending our body.
Okay.
When we encounter a virus like hepatitis, our body produces antibodies.
Right.
These antibodies are like specialized soldiers
Interesting.
trained to fight that specific virus.
Okay.
Serological tests can detect these antibodies in your blood,
Uh-huh.
helping doctors determine if you've been exposed to a particular type of hepatitis virus.
That's a really helpful way to think about it.
Yeah.
So blood tests, serological tests, anything else?
Sometimes doctors might recommend imaging studies like ultrasounds or MRIs.
Okay.
These allow them to visualize the liver, see its size and structure, helping to assess the extent of any damage.
And in some cases, they might even perform a liver biopsy, right?
Yes, that's right.
Okay.
Now, while it might sound intimidating, a liver biopsy is generally safe and well tolerated.
Okay.
It involves taking a tiny sample of liver tissue to examine under a microscope.
Okay.
This can help determine the extent of inflammation or damage,
Uh-huh.
giving doctors really valuable information to guide treatment decisions.
So that makes sense.
Yeah.
So let's say you've gone through all this and you've received a diagnosis.
Okay.
What's next? What kind of treatments are available for hepatitis?
That's where things get really interesting.
Okay.
And in many cases reassuring
Okay.
for hepatitis A and E,
Uh-huh.
which are often acute,
Right.
meaning they tend to resolve on their own.
Okay.
The focus is on supportive care.
Okay.
Rest fluids and a healthy diet
Yeah.
can go a long way in helping your body recover.
That's a relief to hear.
Yeah.
But what about the other types?
Well, hepatitis B and C are where we've seen incredible advancements.
Okay.
For hepatitis B, we have antiviral medications that can suppress the virus,
Right.
preventing complications like cirrhosis and liver cancer.
Yeah.
And for hepatitis C,
Yeah.
we're now talking about cures.
Wow.
Direct-acting antivirals, or DAAs, have revolutionized treatment,
Okay.
offering high cure rates
Yeah.
with relatively short treatment durations.
It's incredible how far medical science has come.
Absolutely.
That must be incredibly reassuring for people facing these diagnoses.
It is. It is.
And even for people with chronic hepatitis,
Yeah,
which requires ongoing management, there's still a lot of hope.
there is.
Lifestyle modifications like maintaining a healthy weight, limiting alcohol intake,
Yeah,
eating a balanced diet
absolutely.
can have a significant positive impact on liver health and just overall well-being.
For sure.
So there's a lot that people can do
Yeah.
proactively to manage their condition.
Uh-huh.
And of course, regular medical checkups are crucial.
Yeah, absolutely. Regular monitoring allows doctors to track liver function
Right.
and make adjustments to the treatment plan as needed.
Okay.
So it's all about staying on top of things and being proactive about your health.
And speaking of proactive,
Yeah,
we can't forget about prevention.
absolutely.
What steps can people take to reduce their risk of getting hepatitis in the first place?
Well, we're incredibly fortunate to have effective vaccines for both hepatitis A and B,
Okay.
offering long-term protection.
That's amazing.
Yeah,
Vaccines have been such a game changer for so many diseases.
absolutely.
And it sounds like they're playing a crucial role in the fight against hepatitis as well.
Definitely.
But aside from vaccines,
Yeah.
are there any everyday things that people can do to lower their risk?
Like practicing safe sex,
Okay.
avoiding sharing needles,
Right.
and ensuring the safety of blood donations
Okay.
are all crucial for preventing the spread of blood-borne hepatitis viruses.
Those are all important points. And I imagine good hygiene practices are essential too, right?
Absolutely.
Okay.
Simple habits like washing your hands thoroughly,
Uh-huh.
especially after using the restroom and before handling food,
Right.
cannot be overstated.
Yeah.
It might seem basic, but it's a powerful defense against many infections,
Yeah.
including some types of hepatitis.
Okay, so this is all incredibly useful information.
Yeah.
But I'm wondering,
But
what are the potential consequences if hepatitis is left untreated or poorly managed?
it's a serious topic,
Yeah.
but one worth discussing.
Mm-hmm.
While we've been focusing on prevention and treatment,
Right.
it's important to acknowledge that hepatitis,
Yeah.
if not managed effectively,
Right.
can lead to some serious health complications.
So what are some of the things that people should be aware of?
Well, one major concern is the development of cirrhosis,
Okay.
which is a condition where healthy liver tissue
Mm-hmm.
is gradually replaced by scar tissue. And this scarring impairs the liver's ability to function properly.
And what happens when the liver can't do its job effectively?
Well, it can lead to a cascade of complications.
Uh-huh.
One example is portal hypertension,
Okay.
where blood pressure increases in the portal vein,
Right.
which carries blood from the digestive system to the liver.
Okay, help me visualize this.
Sure.
What exactly is happening in the body when this occurs?
Imagine a highway with a major traffic jam.
Okay.
That's essentially what's happening in your liver's blood vessels
Yeah.
with portal hypertension.
Okay.
The flow of blood is obstructed,
Right.
causing a buildup of pressure.
Uh-huh.
This can lead to fluid accumulating in the abdomen,
Right.
a condition called ascites,
Okay.
and enlarged veins in the esophagus called varices,
Oh.
which can be dangerous because they have the potential to rupture and bleed.
Wow. That doesn't sound good at all.
It's definitely a serious complication,
Yeah.
but there's also a silver lining here.
Okay.
With proper management and early intervention,
Right.
many of these complications can be prevented or effectively managed.
Okay.
So the outlook for people with hepatitis is not all doom and gloom.
That's encouraging to hear.
Yeah,
So even if someone develops a chronic form of hepatitis, there's still hope for a good quality of life.
absolutely.
Hmm.
Acute hepatitis often resolves completely,
Okay.
and chronic hepatitis, while requiring ongoing care,
Right.
can be managed effectively thanks to the advancements in medicine.
Yeah.
People can still live long and fulfilling lives.
That's reassuring.
Yeah.
And what about for people with severe liver damage?
Okay.
Are there any options available to them?
In cases of severe liver damage,
Uh-huh.
liver transplantation can be a life-saving option.
Okay.
It's a major procedure,
Right.
but it offers a second chance for many.
That's truly remarkable.
It is.
It sounds like there's always hope, even in the face of challenging diagnoses.
There is. Medical science is constantly pushing boundaries
Right.
and discovering new ways to treat and manage hepatitis.
So even though this is a serious disease,
Right.
it's not an automatic dead end.
No.
There's a lot we can do,
Yeah,
both individually and collectively,
for sure.
to address this challenge.
Absolutely. And with ongoing research and development
Uh-huh.
of new treatments and preventative measures,
Right.
the future for people with hepatitis is looking brighter than ever.
That's fantastic.
Yeah.
But before we wrap up this part of our deep dive,
Okay.
I'm curious.
Yeah.
Are there any specific advancements that have you particularly excited about the future of hepatitis treatment?
Well, there are definitely some promising areas
Okay.
that I'm eager to see develop further.
Okay.
One area that holds immense potential
Uh-huh.
is the development of new antiviral therapies for hepatitis B.
Okay.
While current treatments can effectively suppress the virus,
Right.
they don't eliminate it completely.
Okay.
So researchers are working hard to develop therapies that could achieve a functional cure,
Okay.
meaning the virus becomes undetectable and no longer poses a threat to the liver.
That would be incredible.
Yeah.
A functional cure would be a game changer.
Absolutely.
For so many people living with chronic hepatitis B,
For sure.
what other advancements are on the horizon?
Another exciting area is the development of therapeutic vaccines for both hepatitis B and C.
Okay, this is where I need a little more explanation.
Sure.
How are therapeutic vaccines different from the preventative vaccines we talked about earlier?
That's a great question.
Okay.
Preventative vaccines are given to healthy individuals
Right.
to prevent them from getting infected in the first place.
Okay.
Therapeutic vaccines, on the other hand,
Yeah.
are designed for people who are already infected.
Okay.
They aim to boost the immune system's response to the virus,
Okay.
essentially training it to fight and clear the virus from the body.
So therapeutic vaccines could potentially cure existing infections?
Yeah, it's still in the early stages of research,
Okay.
but it holds immense promise.
Wow, that's incredible.
Yeah. And then, of course, there are advancements in liver transplantation, which is a critical intervention for people with end-stage liver disease.
What kind of progress are we seeing in that area?
We're seeing remarkable progress
Right.
in both surgical techniques and the management of transplant recipients.
Okay.
One particularly exciting development is the use of living donor liver transplantation.
Wait, living donor?
Yeah,
You mean someone can donate part of their liver while they're still alive?
exactly.
Yeah.
It's an incredible testament to medical ingenuity.
Wow.
A portion of a healthy liver is donated by a living person, usually a close relative or friend.
Okay.
This has significantly expanded the pool of potential donors,
Right.
offering hope to more people in need of a transplant.
Wow, that's truly remarkable.
It is.
It's amazing to see how science and medicine are constantly finding new ways to improve outcomes for people with hepatitis.
Absolutely. We've
Yeah.
come a long way, but there's always more to learn and discover.
Uh-huh.
And that's what makes this field so exciting.
I completely agree.
Yeah.
So that wraps up part 1 of our deep dive into hepatitis.
Okay.
We've covered a lot of ground from the different types and causes to the latest treatments and advancements.
Yeah, a lot of information.
But the journey doesn't end here. Join us in part 2, where we'll take a closer look at the global impact of hepatitis.
Sounds good.
Stay tuned because the conversation gets even more fascinating from here.
Definitely.
We'll see you then.
Welcome back to our deep dive into the world of hepatitis.
In part 1, we talked about the different types of hepatitis, how it's diagnosed, and the promising treatments that are available.
Right.
But hepatitis isn't just a personal health issue, it's a global challenge.
That's a crucial point. Hepatitis affects millions worldwide, and the burden is particularly heavy in certain regions. What's fascinating is how hepatitis intersects with social determinants of health,
Okay.
like poverty, access to healthcare, and sanitation.
Now, I've heard that term before, social determinants of health.
Yeah.
But I'm not entirely sure I understand what it means. Can you break it down for us?
It's the idea that our health is influenced by a web of factors beyond just our biology.
Okay.
Things like where we live, our income, our education level, and access to quality healthcare all play a role.
So it's not just about individual choices,
Right.
but about the systems and circumstances that shape people's lives.
Exactly. And these disparities can have devastating consequences.
Yeah.
The World Health Organization has recognized this and set a goal to eliminate viral hepatitis as a public health threat by 2030.
That's a bold vision.
Yeah.
But what does elimination actually mean in this context?
Well, it doesn't necessarily mean eradicating the virus entirely.
Okay.
The goal is to reduce new infections by 90% and hepatitis-related deaths by 65%.
Wow.
These targets are based on the success of other global health initiatives, like the eradication of smallpox and the near elimination of polio.
Those are some inspiring examples.
Yeah, they are.
So how are we going to achieve these goals for hepatitis?
Well, the strategy involves a multi-pronged approach, focusing on prevention testing and treatment.
Okay.
Expanding access to the hepatitis B vaccine, especially in high-burden countries, is absolutely vital.
Right.
And for hepatitis C, where we now have highly effective curative treatments,
Yeah.
the focus is on scaling up testing and linkage to care.
Testing seems key here, especially since you mentioned earlier that many people with hepatitis C don't even know they have it.
That's right. It can be a silent infection for years.
Wow.
slowly damaging the liver without noticeable symptoms.
So it's really important to get tested.
It is. That's why widespread testing, particularly in high-risk populations, is so crucial
Yeah.
for identifying those who need treatment and preventing further transmission.
And once someone is diagnosed, what happens next?
Well, connecting them to care and ensuring access to affordable medications is essential.
Right.
This can be a logistical hurdle, but the potential rewards are enormous.
Yeah.
Imagine a world where hepatitis no longer poses a major public health threat.
It's an inspiring thought.
Yeah,
It sounds like a massive undertaking,
it is.
but it also sounds like it's achievable with the right combination of effort and resources.
It definitely requires a collective effort from governments, healthcare providers, and communities worldwide.
And that includes individuals, right?
Absolutely.
What can people do to contribute to these global efforts?
Staying informed about hepatitis,
Okay.
advocating for increased funding for research and public health programs,
Right.
and supporting organizations working to eliminate this disease
Okay.
are all ways to make a difference.
So it's a reminder that even on a global scale,
Yeah.
individual actions can have a ripple effect.
Now, while global efforts are incredibly important, let's shift gears for a moment
Okay.
and delve into some of the latest research and innovations in the field of hepatitis.
Okay. I'm always up for a good science update.
All right.
What are some of the advancements that you're most excited about?
One area that's incredibly promising is the development of new antiviral therapies for hepatitis B. As we discussed, current treatments can suppress the virus, but they don't eliminate it completely.
Right.
So researchers are working tirelessly to develop therapies that can achieve a functional cure.
Reminding again, what does functional cure mean?
It means the virus becomes undetectable in the blood
Okay.
and is no longer actively replicating, so it no longer poses a threat to the liver.
That would be incredible.
Yeah.
What other advancements are on the horizon?
Another exciting area is the development of therapeutic vaccines for hepatitis B and C.
Okay.
These vaccines, unlike preventative vaccines, are designed to stimulate the immune system to attack and clear the virus
Okay.
in people who are already infected.
So they're like a treatment in vaccine form.
Exactly.
That's interesting.
While they're still in the early stages of development,
Mm-hmm.
they hold immense potential for curing chronic infections.
Wow.
And we're also seeing remarkable progress in liver transplantation,
Right.
both in surgical techniques and in the management of transplant recipients.
Are there any specific breakthroughs in transplantation that you find particularly promising?
One exciting development is the increasing use of living donor liver transplantation,
Okay.
where a portion of a healthy liver is donated by a living person,
Right.
usually a close relative or friend.
It's amazing to see how science and medicine are constantly pushing boundaries to improve the lives of people with hepatitis.
It truly is. And while these scientific advancements are incredibly important, we can't forget about the social and systemic factors that contribute to the global burden of hepatitis.
You're talking about the social determinants of health we discussed earlier, right?
Exactly. Addressing those factors is crucial.
Okay.
We need to ensure equitable access to healthcare, reduce stigma,
Right.
and create a world where everyone has the opportunity to live a healthy life free from the threat of hepatitis.
So it's a powerful reminder that the fight against hepatitis involves both scientific progress and social change.
And that brings us to the end of Part 2. In Part 3, we'll explore this intersection of personal responsibility and public health in more detail.
We'll look at how individual choices and societal interventions intertwine and discuss how we can all play a role in creating a healthier and more equitable world.
Stay tuned.
Welcome back. We've explored the science, the global impact, and all the exciting advancements in hepatitis research.
Yeah.
But there's another layer to this conversation that I think we need to address,
Right.
and it's this intersection of personal responsibility and public health.
It is a fascinating dynamic, isn't it?
Yeah.
On one hand, we have the power to make choices
Right.
that directly impact our health,
Uh-huh.
like getting vaccinated,
Yeah.
practicing safe sex, and avoiding harmful substances.
Right. Things we can control.
Yeah.
But on the other hand, there are these broader societal factors that influence our health.
Right.
Like access to healthcare,
Yeah.
education, and social support.
Absolutely.
It's like we're navigating this delicate balance.
It is. Between individual agency and these systems that shape our lives.
Exactly. Take hepatitis B vaccination as an example.
Okay.
It's a highly effective way to prevent infection.
Yeah.
Yet vaccination rates vary widely across the globe,
Right.
often due to disparities in access and affordability.
So while it's crucial to encourage individuals to get vaccinated,
Right.
we also need to advocate for policies and programs that make vaccines accessible to everyone.
Absolutely. It's about creating a system
Yeah,
that supports individuals in making healthy choices
right.
while also addressing those systemic barriers.
And this applies not just to vaccines,
Mm-hmm.
but to access to testing,
Yeah.
treatment, even basic healthcare services.
Absolutely.
It sounds like public health initiatives play a really crucial role in bridging those gaps.
They do programs that provide free or low-cost testing,
Mm-hmm.
outreach to high-risk populations, and education campaigns to raise awareness about hepatitis
Right.
are all essential for ensuring that everyone has a fair chance at a healthy life. Yeah, it's about creating a safety net
Yeah,
that catches people who might otherwise fall through the cracks.
for sure.
But it's not just about providing services, is it?
Right.
We also need to address the stigma surrounding hepatitis.
You're right. Stigma can be a major barrier
Yeah.
to seeking testing or treatment, especially for hepatitis B and C.
Uh-huh.
It can lead to discrimination, fear, shame, perpetuating the cycle of transmission.
So how do we combat that stigma?
Open and honest conversations are key.
Okay.
By talking about hepatitis,
Uh-huh.
sharing accurate information,
Okay.
and challenging misconceptions,
Yeah.
we can create a more supportive and understanding environment for those affected by it.
It starts with each of us, right?
It does.
By being informed, compassionate, and advocating for those who are marginalized.
Exactly. Our words and actions can have a ripple effect,
Right.
shaping perceptions and influencing behaviors.
Mhm.
We all have a role to play in creating a world where hepatitis is no longer shrouded in stigma.
So as we wrap up this deep dive into the world of hepatitis,
Yeah.
I'm left with a sense of both hope and responsibility.
Uh-huh.
Hope because of all the incredible advancements in treatment and prevention,
Right.
and responsibility because we all have a part to play in creating a healthier world.
I couldn't agree more. By understanding the science, acknowledging the complexities, and working together,
Yeah.
we can make a real difference in the fight against hepatitis.
Thank you so much for joining us on this journey.
Of course.
We've covered a lot of ground, but we hope you've gained some valuable insights
Yeah.
and a deeper understanding of this complex and often misunderstood disease.
Absolutely.
Knowledge is power,
It is.
and by staying informed and engaged,
Uh-huh.
you can be a part of the solution.
That's right.
Thanks for listening.